Good evening once again and welcome everyone to today's session. And today is our 1421st day of continuous webinar. Thank you all the participants, all the faculties for your support. And today's our guest is Dr. SRINIVASAN. He's MD in homeopathy. He's a visiting professor of Shivraj Homeopathic Medical College, Salem. He got MD from Sonaji Rao Krish Sagar Homeopathic Medical College, Maharashtra. He's speaker of various conferences in Chennai and Canada and visiting professor of Shivraj Homeopathic Medical College and 22 years of experience. I'm welcoming Dr. Srinivas to our session. Thank you, sir. I have to share the screen, right? I'll share. Is it visible, sir? And, oh, sorry. Srinivas, sir? Is it visible? So please unmute yourself and please.
Yes, it's visible.
Ah.
So I will tell the slide number, then you can move the next slide.
Okay. No.
All the slides
this
are
is
numbered.
the first. Okay. This one is the first.
Yeah, this is okay.
Okay.
So, to handle varieties of injuries, I don't use any specific remedy, favorite remedy, well-known remedy, high-grade remedy, or someone recommended, nothing of that sort. If I spend 1 or 2 extra minutes with each case of injury, in taking the case, we find extremely refined points, most individualizing features about the injury nature, and we will find exact reference in KNERR'S repertory. So today I will present different types of injury rubrics, and I used at least this remedy once in my career. And here is the reference. Anyone who like to parallelly see the rubrics, the remedy, can use this website, homeoint.org. And if you click open, you see left column and right column. In the right column, you find C herring, and to the next to that, you find guiding symptoms. And if you click guiding symptom and you raise the screen, gradually you will come to a chapter called Touch, Passive Motion and Injury. That is chapter number 45. So this is the chapter which I used extensively for reference. The case taking and minute observation in each case had always found its reference in KNERR'S repertory. This chapter, this subchapter, chapter 45, touch, passive motion, injury, and you click chapter, subchapter, injury, you find the rubric which I am telling one after the other. So this is broadly about what I did in this presentation. And there are two things. How these injury rubrics entered Materia Medica and repertory. One is largely from clinical experience. And on the Materia Medica side, the totality was different. That remedy was prescribed even though there is an injury. And it is repeatedly verified clinically. And it got added up in repertory and Materia Medica. And another thing is like in proving, similar sensations came up, like burnt as if, scalded as if, received punctured wound as if, received cuts as if, received incisions as if, received bruises as if. So these sensations in Materia Medica, when applied in clinic, in those actual clinical conditions, produced wonderful relief and healing. And slowly these things got added up in repertory and Materia Medica. So this way, it is from clinic to Materia Medica, from Materia Medica to clinic, repertory, and all those things. And one more thing, largely I used 1M and 10M potencies in all these 20 cases. And those 1M and 10M wherever available in the clinic, the medicine and the potency, those produced quick result, deep and long healing. Where it is not available, I gave 200, still not available 30. Those also help. Maybe 230 required little longer time and more doses. That is the only difference. Otherwise, whatever potency you have, you use. What I used largely is 1Ms and 10Ms, which work very quickly. So that is the overview. And now we'll go to case number 1. And one very important learning I had was not to use any specifics or like so-called most commonly used remedies. So NER repertory will give such wonderful direct references, what you see in clinic. If you spend 1 extra minute with the case, you find wonderful individualizing feature in every case of injury and direct reference. So this was one patient where different medical history, to cut it short, where the focus was on injury. There was a bed sore which is getting putrefied. Putrefaction was taking place. And in NER repertory, in that chapter, you go to injury subchapter, bed sore, putrid, the remedy is hypoxaninum. On giving hypoxaninum, the first putrid smell gone, the bed sore healed so beautifully, and that helped in general health of the patient also, where the patient was already on antibiotic, local dressing, air pillow, nothing was actually helping. And they were planning for a graft also. At that point, the relative came and told the story. And on this basis, hypoxaninum was given and patient became completely all right. The bed sore healed beautifully. So case 2. My friend, Dr. Joseph Paul is in Canada. At one period of time, in the middle of night where he was living, at least one case will come with a scorpion sting, with a typical ledum picture. He used to give them ledum. So instead of calling him Joseph Paul, we started calling him ledum Paul. So one old lady came to me with a history of a painful ulcer wound, and it is after a rat bite. So we go to nerve repertory and injury chapter, injury, bite. There are several bites, including human bites also. So anyone who want to see, you can parallelly see the chapter in your laptop or mobile, whatever. You go to nerve repertory, that website, nerve repertory, this chapter, and bite rat. The remedy is Ledempol. On giving Ledempol, the first thing that happened was very quick relief in the pain. First thing. And second thing, the wound started healing. The healthy granulation came up and it became completely healed. And there is no constitutional symptoms. Usually, these things goes into fever, chills, rigor, lymphadenitis, sloughing. Those things may happen, not always. Local infection and all that. And I said, don't give any TT or anything. I tell them, what I tell them is it involves bit medical legal aspects. So where maybe there are many participants here who practice overseas as well. So what I generally tell them is, first you take the medicine and let us wait. If you improve very quickly, if the wound heals very faster, if there is no constitutional symptoms, let us postpone all such injections. So it involves every country's medical legal things also. And as patient improves, they feel very comfortable and we can handle the medical legal situations as well. So that is case number 3. Now, one patient came, patient told, even a smallest punch like this, a small blow from the stick or a punch causes discoloration in that area. Either it is
Sir, sorry. Actually, I cannot accept the guest. That's why I'm clicking. When I am clicking, that's moving. Now it is okay. You can.
It is all right. Feel easy.
Okay.
No problem.
Okay.
No problem.
Okay. Thank you.
So, a smallest injury or smallest blow causes skin discoloration. It becomes a purple patch, a blue patch, sometimes a green, sometimes a red, whatever. The color changes. So, there is blow, injury, blow type, and ecchymosis from slightest blows also. So the system is so delicate. The vessels rupture, the skin is so thin, and the remedy is Agaricus muscarius. So I asked him, are you eating mushrooms too much? So this is one question when something like that comes, I ask patients. He said, no, sir, I don't eat mushrooms. Some people say, yes, they use a lot. So I request them to withdraw using that dietary item for at least 3 months' time to check whether medicine acts faster. Or some people have, interestingly, they have aversions also to mushrooms. There also this comes up. So here there is a direct indication. Injury, blow, ecchymosis from slight on giving agaricus. The tendency to ecchymosis from slightest blows completely disappeared. Case number 4. Next. One patient had glaucoma. The pressure was constantly increasing over a period of years. And the patient was on allopathic medications, internal medicine, drops, and doctor suggested venting, this and that surgeries, and there is risk of losing vision and all that was there. At that point, patient came, the full history was taken in the usual way, full history. Then at one point, patient told, during childhood, while playing, there was a powerful blow on the eye. And the patient said, I'm not sure whether this would contribute for my illness, but I felt like telling him. Said, okay, let us see. Then the chapter was opened, and there, blow eyes upon caused glaucoma. The remedy was physostigma. So on giving physostigma, I think in this case I gave uh, 1M potency and followed with LM also, because I was a bit hesitant whether that alone is enough or I should follow with repeated dose of adjusted dose LM potency. On giving it constantly over a period of 3, 6 months and 1 year, the glaucoma is completely gone and there is no surgery and vision completely restored. Patient was very happy and I stopped the medicine also. Okay. Case 5. So you must be seeing that there are things that remedies that comes up which we generally don't think. You know, we generally think of arnica, ruta, or something like that. So there is beautiful, exact references with completely different remedies, which generally doesn't occur to us. And that has produced wonderful results. Now, then, here is a patient, that is the first episode. See the characteristic in that. A blow on the nose, sometimes nothing happens, there is a pain, swelling, redness. In this case, there is nosebleed, which was profuse and sudden. So that profuseness and the suddenness, and the remedy is elapsed corioliness. So otherwise there is no need to pack with cotton or ice pack, nothing like that. So on giving elapsed corioliness, the bleeding came down very quickly and there is no clotting, no block of the nose, and patient did well. Case 6. Okay. The patient had been to ophthalmologist because of the dimness of vision, which is constantly progressive. And various tests, and every time the diagnosis was different. Sometimes the doctors are not clear and varied treatment is being tried, nothing helped. And said, okay, chalo, let us try homeopathy. And the history was taken. And the boy had a mischievous behavior sometime and didn't perform well in the school or something happened like that at home. And father was very angry because of something that happened unusually. And he lost his control, temper, and he hit the child with a stick on the head. And then that time nothing big, and child had been to some doctor, took some injections and tablet. It's totally they have forgotten. And on careful history, this point came up. And then I found this rubric: injury, blow, head over with a stick, followed by dim sight. So the remedy was ammoniacum gummi. Even though the injury was not and the effect was not immediately recognized, there was some time gap, but the thing progressed slowly. I correlated these two. There is no exact time zone, like if it had happened within this time period, you use it. You carefully take the history and then look for a reference. If it is there, read that in Materia Medica and then give the remedy. So on giving ammoniacum gummi, the vision become completely all right to the relief of the child and family. So here, another important learning is I bother less and less about the name of the disease. Sometimes the specialist is not clear. Sometimes the diagnosis is not evident. Sometimes different specialists give different diagnosis. So it is all lesser important when it comes to selecting a remedy, not to include it in totality. We keep a diagnosis to monitor, to watch the progress, child is improving or a patient is improving or not. The role is quite small. So I don't use a diagnosis or diagnostic name for totality or prescribing a remedy. Case number 7. Bruises, like a person falls on a rough surface while doing some work or accidentally or in road traffic injuries. And the part is ecchymosed from bruises. The rubric is there directly in repertory. On giving a potency sulfuric acid, some literature, I don't know the book name, sulfuric acid 3x made into some liniment or ointment applied on bruises or ecchymosed part will give quick relief. I have not tried it. I gave potency internally, which brings down the pain, burning, bruise sensation very quickly. It comes down by internal medication, and also the wound heals so well, even though it is contaminated or roadside accidents, whatever, there is no chance of infection or sepsis or anything on the wound. And there is no scarification also. Wound heals so nicely, like the skin becomes baby skin. Okay, so bruises, especially when ecchymosed, sulfuric acid works so wonderfully. All these are not specifics. There is exact reference in this repertory, in this chapter, in this subchapter. Anybody can see, refer it again and again and again, use it. Case number 8. I never thought I will give zincum metallicum in an injury. It generally doesn't come to me. This man had a testicular swelling. As usual, X-ray, blood investigation. Even he was asked about venereal diseases in the past, extramarital relationships. He said no, ultrasound. Everything was done. Only the testis is swollen, and hydrocele is also ruled out. And they worked out for tumors, tumor markers, all negative, but the pain is there. And this happened after some bruise, maybe after a fall, the testis got bruised. That is the history he told. Sometimes they feel delicate to tell the full history also. Said, okay. So the rubric is injury, bruises causing over the testis orchitis. And the remedy is zincum metallicum. On giving zincum metallicum, the swelling is gone, the pain is gone, patient is completely all right. Patient become better. Okay. And next is this is a pregnant woman. See, some homeopathy is so fascinating. There is nothing called a routinism. Every case, every moment, we learn something. There is a joy. Pregnant woman, and she came with a bruise and which is suppuration, and there is a pain. So on going to the repertory, I saw crocus sativa. So I asked her, in India, mother or either naturally she has an inclination or pressure from family, mother-in-law, husband, or her own mother will say the child should be pink, white.
Sir, excuse me, sir. Can you do one favor? Can you see the participants waiting?
No.
No? Oh, then
One
it's
minute.
okay.
I will see whether I can share the screen.
Okay.
If that will help you. So you are now free from screen share?
Yeah. Because I cannot see them even. Thank you, sir.
I understand.
Thank you so much. Because when 5 are waiting, but I am about to accept them, it's not possible. Thank you so much.
Now, okay. So
Thank you,
this lady is pregnant. You know, it is so common in many parts of India to take crocus, saffron in the milk. And there was one Tamil movie by Rajnikant. Movie name is Sivaji, where the heroine funnily says, "You are dark colored, so we cannot marry. See, I am quite fair." So he goes home and put this much saffron in milk, make a shake and drink a lot to become fair. So I was curious whether this lady was taking crocus sativa. She said, "No, no, sir, I am not taking." So even if would have told, I would say, "Okay, withdraw taking it. I'll give you medicine." So I gave her crocus sativa. The pain subsided quite quickly and the suppuration disappeared. The wound healed so well. Okay. And see, it is, there also will be reluctant. Suppose if they are taking crocus, whether to continue or stop, whether they can take homeopathic medicine during pregnancy, will it be safe? And all the questions will come. Said, okay, you take. Case number 10. The patient was hospitalized and the burns percentage was somewhere around 75 or 80. And the doctor said the prognosis is bad. Patient was on ventilator and IV fluids were not working and the patient was on cut down and 4 lines of IV cut down was done. At that point, they said, "Shall we try something with homeopathy?" He said, "Okay, let us see." Patient was on heavy dose antibiotics and ventilator support. And the rubric is injury, burns, extensive, carbolic acid. Said, okay, let us try. Carbolic acid was sent in alcohol base. And the allopathic doctor said, anyway, patient is bad. You try anything you want. So I said to put 1 drop of the medicine in the ventilator. You just open it, put a drop and reconnect. So anyway, it is olfaction method. It will go in. In 3 days, they are able to wean the ventilator in 3 days' time. And then slowly, they have put one another tracheostomy was already on to which patient was connected. And slowly, the need for antibiotic reduced. The constitutional symptoms started reducing. The wound started gradually healing. Now the doctor said, let us see. It seems patient is responding to this treatment. You continue this, we will give supportive measure. And in 3 months' time, patient came out of the hospital. So then I lost follow-up. I don't know whether the patient underwent any cosmetic surgery or not, that I don't know. But this helped the patient to be alive and bring them out of that ventilator and survive and get discharged alive. So that was only case. After that, I never had the chance. So that was one eye-opening experience. So here, even though it is not related to injury or our nerve repertory, I want to tell one thing because many young doctors must be listening to this. We are reading prognosis in medicine book and surgery book while doing undergraduation or post-graduation. Any disease, there is prognosis. Please close that prognosis from your book. You have cleared your exams, okay, leave it. Don't read prognosis for any case. I'll tell you why. There was one Mr. Ellis Barker in England. He was a non-medical person, got trained with J.H. Clark, John Henry Clark, the dictionary material. What he did was, he goes to Royal London Hospital, England, cancer ward, where diagnosis is stage 4 cancer, patient will die in 1 week or 10 days. Ellis Barker will bring them home, change their diet, give homeopathy medicine, made them live for 7 years, 10 years, healthily, without medicine, without cancer. Non-medical person, least bother about prognosis, stage of disease, name of disease. His book is there. James Ellis Barker, Cancer. Okay. So don't bother about the let us be serious. I don't say be funny or easy, but let us not get carried away by name of disease, diagnosis of disease, stage of disease. There is a reference. Take the case, go to the repertory, go to Materia Medica, give the remedy, watch carefully, see that patient improves. That is a lesson I have learned, and I recommend this to all of you. Case number 11. Again, another case of burns, not that extensive as I was telling in case number 10, but it started suppurating. First formation was there, and all the related symptoms. So there, I went to the repertory, saw the remedy, and it is Calcarea sulfurica. On giving Calcarea sulfurica, the suppuration stopped, the pain stopped, the throbbing is gone, and the wound started healing very, very clearly. In all these cases, I have not used any mother tinctures for local applications or the same remedy locally. No, no, not even homeopathic mother tinctures. Patient says, I want to wash with warm water, do. Want to wash with a betadine solution, do. Hydrogen peroxide, do. You want to wash with any homeopathic solutions, do. Soap and water, it's okay. It is all left to them. But I have not recommended any of these things. Rather, if they ask, rather, I would say, try to avoid as far as possible. Wherever it is needed, wash with plain water, hot or cold, and a little bit of soap to keep it just clean and keep it dry as far as possible. That is the only thing. If needed, if the wound needs to be closed, do a covering so that the flies or mosquitoes or other things and the disfiguration is not quite obvious. And those things, slight covering, that is the thing. Okay. So that is case number 11. Case number 12. Patient developed hard of hearing, almost. Meant to many neuro doctors, ENT doctors, nothing could help. Hearing aid also could not, it was quite noisy and all those things, and they could not afford for quite extensive or expensive things. Said, okay, right. So there was a history of injury to head and brain concussion in the past, and the reference is injury, concussion, brain, deafness. The remedy was chininum sulfuricum. On giving this, the deafness completely gone. The patient and the family was very, very happy. Okay. Digitalis, we commonly think for heart and not more than that. Sometimes for prostate injury. See the minute quality of the symptom. Patient received a cut injury and patient told, sir, strangely, the blood is dark in color, it is thicker and coming out slowly. Dark, thick and coming out slowly. So cut injury, blood sluggishly escaping, and it is dark and thick. So many qualitative attributes. And the rubric is there exactly in the repertory. The remedy was digitalis. I asked the patient, do you have any heart disease? Are you taking any digoxin tablet? No, sir, but there is a family history of heart disease. I am also afraid, will I get any heart disease? And I am trying to do something to prevent dieting, exercise, yoga, meditation, all that. Said, okay. But as of now, there is no heart ailment in the patient. I gave digitalis and patient quickly recovered. I think I followed the patient for 3 years just for my curiosity whether digitalis helped him in preventing cardiac illness also. For 3 years, there is no cardiac symptoms, and then I lost follow-up. So exact reference is there in the book. It needs 2 minutes extra patience and careful observation in the patient and look for the reference in the book. Case number 14. This, of course, many of you must be knowing, cut sharp instruments from glass, even surgical instruments where it is sharp cut. Staph aureus is a wonderful remedy, and this has helped in many cases for quick relief of pain, stop bleeding, and promote healing on its own, mostly without suturing. Sometimes, if the gap is too wide, sometimes it requires suturing. Otherwise, lingering pains and surgical pains with sharp cuts and the Staph aureus is wonderful and produce wonderful healing also. This the another thing which I want to say, most of the time, suppose if you are reluctant to take up such cases where patient is advised surgery, you can refer to your colleague, you can refer to a senior doctor. Try for some more time in treating such cases with homeopathy before referring them for surgery. Cataract is one example. Glaucoma is one example. Inguinal hernia is one common example. Many times, suppose if I take 10 cases of hernia, 8 patients, the hernia will completely go, and 2 may go for surgery. Maybe had they gone to another homeopath or tried something else, even they would have avoided surgery. But my success rate is something like this. Take a very careful history, and every case requires different indicated remedy. There is no favoritism, common remedy, most useful remedy, high grade remedy. No, no, no. Okay, so once this patient had an inguinal hernia, and there was a history of fall on the abdomen. So on this basis, injury, fall causing inguinal hernia, Eugenia jambos. What is the mechanism in the patient by falling on abdomen? Patient developed hernia, I don't know. Maybe we can read in surgery books, old classical textbooks. And on giving Eugenia jambos in LM 1, 2, 3, 4, 5, 6, the hernia is completely gone and no surgery. There are some cases like this. In the entire 20 presentation cases, I used LM potency to follow, and most of the cases are otherwise 1M and 10Ms, and which has completed the job. Okay. Allium SEPA for injury. Sir, of course, all of us are adults here. I want to tell you, I tell my friends and patients and the shoes, the footwear and inner garments must be of right size. If these two are inappropriate, the life will be hell. The footwear and innerwear, both must be appropriate. If it is too loose, also problem. If it is too tight, also problem. So shoe bite or boot causing ulceration, and there is sore feeling and friction injury. In those cases, Allium SEPA is wonderful. So that causes, so we have to change the shoe properly. I don't know whether their foot to become properly shaped and then they're able to wear the same shoe. This I will check. Now it is occurring to me. There was one interesting case. There was one Mr. Bute, B-U-T-E. He is again a non-medical homeopath, practiced in America. I think he learned with Herring or Lipet. I don't know. He was a non-medical person. Once a person in their village had some feet deformity. So that patient went to two surgeons in their village. The surgeons told, we are going for a vacation and we will come back and operate on your feet, you will be all right. And they left. On their coming back from their vacation, this patient went to them and showed his feet. The feet deformity is completely gone. In that period, 15 days or 1 month at time. The surgeons asked him, have you gone to any other surgeon and got operated? You are better now. He said, no, sir, I went to one person called Butte, who is in this street corner. He is a homeopath. I took medicine from him for a few days and my feet is all right. The surgeons became so curious and they went to Butte and said, we want to see your cases. We want to learn from you. Butte said, okay, come sit with me. What is there? And case after case, all those cases which are so-called surgical also, Butte produced wonderful results even in a shortest time. Okay, so now hereafter I will watch if a sore foot friction comes after allium cepa healing, whether the patient is wearing the same shoe and the feet shape become all right. So you also try and give me feedback. It will be very interesting. Case number 17. One favorite, laceration of the lip, calendula internal medication, not mother tinctures topically or calendula ointment. No. Internally also, the bleeding stops quickly, the hematoma dissolves very, very quickly. I tell the patient, if the hematoma is there, you go to a surgeon, ask how many days it will take. Why, they go to the surgeon, they will say it will take so many days and they will come back. I said, don't take allopathy medicine, you take homeopathy, see how quickly it gets resolved. The hematoma goes so quickly, the pain goes so quickly by internal medication. Patient feels so happy and then they have the background idea. Surgeon told it will take so many days, but taking homeopathy, it has produced result in very short period, no? So they know homeopathy acts faster. Because the certificate is from the surgeon and you have produced quick results. So that is more convincing proof. Homeopathy acts faster and that will bring more credit to homeopathy and more patients also. Case number 18. Once, I don't know whether Pierre Smith told this really or to make fun. One patient was having a splinter sensation in the rectum and anus. He went to surgeons, they could not help. He went to many homeopaths, they tried hepa, nitric acid and all that. Nothing helped. And the patient came to Pierre Smith. He examined the patient rectum and he found a splinter there and he removed it. So every time the patient doesn't require medicine, sometimes they require physical examination and manual removal of something also. So actually, patient received a punctured wound from splinter and there was no splinter as such, but the sensation was throbbing and the local complaint was ulceration. Punctured wound, splinter from, which is having a sensation of throbbing and the wound is getting ulcerated. On giving Baratakar, the throbbing gone very quickly, the ulcer healed so wonderfully. Otherwise, we will not think of Baraita in injuries. So the exact reference there, you need not memorize anything. You need not write down these as tips. All these references are directly available for any of you in KNERR'S repertoire. I told you the website. At the end of the session, I will show you the website also again, and they will share in the group. Anybody can see it. Case number 19. Patient said, In Tamil, we call as a pull tadiki pilwan. You stumble on a smallest grass blade, they will fall. So here, there must be some equivalent in Malayalam also. Any Malayalam equivalent for that? You stumble on a smallest grass of and you fall down and injure yourself. Someone can unmute yourself and tell me. No? Okay. This patient was came with one episode of pain, repeatedly getting sprain, and the history is like, even if I lift a small weight, this is roughly 100, 200 ml water. Like even if I carry small weights, I get sprain. So two things I will carefully watch, whether there is any hairline fractures, then the pathology is different. If there is any hemorrhage internally, patient will say like sprain only, no? Muscle tear, ligament tear, hemorrhage, bone fracture. All this we will cross check. Patient said, no, sir, no, all those things I checked, but I get repeated sprains. Nobody could explain. There is no solution either. Can you help? I said, okay. Sprains easily from lifting small weight. Corbo animalis. On giving corbo animalis, this tendency completely gone, and gradually patient is able to lift heavy weights also. So to that extent, patient improved. We will cross check those things as well in follow. Case 20. Even though the contents of vaccines, the preparation method of vaccines, the inoculation technique, the load frequency is all different. You can look for various effects of vaccines under this repertory. Not you always give Thuja for vaccines. No. There are so many. This I'm just showing you as an example. If you go to that injury vaccine, different organs, different effects, different remedies. One patient said, after COVID vaccine, I could not sleep. I tried all sleep remedies. So I took the full case. I tried constitutional remedies also. Most of the cases respond, but this is one patient which did not being helped. So I took this rubric and gave Thuja sleeplessness from vaccination, and he got natural sleep and without any sleep technique, meditation, yoga, or allopathy medicines. Okay, so that is long and short of all that. So this is the website. If you have an Android phone, internet connection, you go to any place, open this repertory. There are so many beautiful chapters. I conduct systematic training of this repertory, how to read, how to use it. So I do that systematically. This is just an example, like we can do so much of beautiful quality work, even just if it is an injury. Okay, so homeoint.org, you go there, log in, just browse, and you see wonderful repertories, wonderful materia medica, wonderful philosophy, journals, articles, cases. It is really wonderful. So now we can go to questions.
Yeah, thank you, sir. Very interesting class, and even the way you are teaching is very calm and conveying message very easily. And the participants, yeah, you are getting many appreciation in the comments.
Unmute yourself and ask question. Then type. If a question is typed, you please read out for me.
Yeah, okay. Please ask your questions. If you
Unmute
Hand raise
yourself
means
and
I
ask.
will unmute yourself and you can ask. Otherwise, if you have questions means what are the potencies used in cases?
Largely, all the 20 cases I presented, most of them received 1M and 10M, sir. It brings a very quick result. Results are faster and deeper also. Some cases required LM potency for regular maintenance and to bring down the pathology gradually and make it completely disappear. Very few cases required LM potency. I start with LM 1, 2, 3, and all dispensed in water, not a dry dose, powder dose, or not pills. The LM potencies are dispensed in water.
Dr. Lata?
Yes, madam.
Okay, you
Yes,
can
madam.
ask the question, doctor.
Namaskaram, doctor.
Namaskaram.
I want a case of abdominal hernia. He 60 years old. He is also having liver enlargement and acidity problem also. Indigestion is also. Abdominal hernia case.
So we have to study the full case.
Yeah,
Select the most appropriate rubric.
yeah.
See the remedy and prescribe.
Okay.
That is possible. You can send the full case to me.
Okay, thank you, sir.
Sir,
Right.
please put your email ID here, so that will be help for Dr. Lata Manoharan to send the case, I think. Okay. Otherwise, okay.
I will give my mobile number and WhatsApp number and email ID also.
Okay.
9443.
Pardon, sir?
944
Yes. Yes, sir.
32
Okay.
944
0932
Yes,
09097.
7. Thank you, sir. I will send.
94432 09097.
Okay, sir. Thank you, sir. Thank you very much.
Okay, thank you, sir. Anyone? Dr. Ram Parvesh Shah? Sir, you can ask. Unmute yourself and ask, please.
Thank you, Dr. Andini. Congratulations, Dr. SRINIVASAN, sir. Very nice presentation for many kinds of injury remedy. I am very glad. Very, very thanks. And natrum salt is the head injury. Describe the medicine. And botulinum is a very good remedy for the. So very, very thanks, sir. Excellent session. Thank you.
Thank you, Dr. Ram Parvesh Shah. And anyone else, if you have questions, please raise your hands. Otherwise, you can type your messages in the chat box. Natrum salt for injury medicine. That is from your side, right, Ram Parvesh? Okay. Dr. Danesh, you can ask now.
Yes. Good evening, Dr. Srinivasan. It's really very good session. Thank you for such a wonderful session. Though I joined a little bit late here, because being Sunday, Monday, it's a very heavy rush in the clinic. That's why. Anyway, I heard there were some of the points in the last part, but it's really excellent because using carbo animalis for such a sprain is something great, because nobody may always may not remember such remedies in such situations. Also, you talk about this tuja in vaccination compliance. Because you only follow solid repertory, or you may
Also.
Total the basic. You are totally following the repertory.
repertory also.
Also, but which repertory gives you the best as far as your experience is concerned?
Depends on the case.
Depend upon the case. In chronic diseases, you stick on to which repertory, the canteen
Chronic
method or
cases also we can use repertory.
okay. Then actually in repertory, what we find is that most of the remedies are something like rare remedies you're getting.
Sir, let us first have 50 friends who meet daily,
Okay.
not 4,000 Facebook friends who say hello, hi.
That's
So,
the
let us
basic
use-
difference.
So let us use well-known common remedies mostly, then less common remedies. I think
Yes.
with some 50 plus remedies, we will do large part of our work.
Exactly. That's a shortcut to the right remedy.
Usually,
Yes. Exactly. Thank you. Thank you for such a beautiful session in this evening.
the PowerPoint presentation can be shared in the group, sir. So everyone can learn from that.
Which
Those
potency,
who are not
which potency you prefer most?
largely 1M and 10M, sir.
Yes, that striking. That's good.
Largely 1M and 10M. That works faster.
Whether we need to repeat these remedies frequently or unfrequently.
Even centesimal potencies, one pill I put in 100 ml bottle water and ask them to repeat frequently. So that gives fast results than dry doses.
Okay.
I don't have a bottle sample.
No
Anyway.
problem. No problem. We can understand. And that's no need.
100 ml bottle.
Once you have shown that in the previous edition of your presentation, how to success it, how to dilute the put the pill into the this bottle, and then how to success like that, you have shown
Yes.
in
Yes.
some of your early presentations.
Thank you, Dr. Danesh. I think,
It's time.
Yes.
yeah, no, I think no one else have question, right? If you have, we have only 1 minute. I think we will move
Please
the-
call Bob Lim. Please call Bob Lim is there.
Yeah, Dr. Bob Lim.
He will say auto thanks also. Like if
Dr. Bob Lim, you can unmute yourself and where is he?
maybe some network issue, otherwise Dr. might have done.
Anyway, on behalf of IFPH, thank you so much for coming. The way you are taking the class, it's that you are talking to us. Nice presentation, and even nice, even the great knowledge also. Thank you so much, sir. Bob Lim, you can unmute yourself. Anyway, thank you, sir. Come again. And we are moving to the Malayalam session. I'm inviting Dr. P. Shaila.